morning. This is Dr. John Bennett broadcasting from Miami Beach, beautiful Miami Beach. We're collaborating with the EWNS of Egypt and with Sam El Morsi, and Sam is going to run the show today. Welcome, Sam.
Thank you, John. Dear friends, thanks a lot for accepting my own invitation to fourth session of EWNC Academy Neurosurgical Approaches series, Brainstem Approaches series. Welcome all, and thank you all for accepting my own invitation. It's our honor to start our schedule with Professor Ahmed Kanan, and I will make him his turn. Thank you.
Thank you, Professor Sameh, for the kind invitation and for John running this Zoom webinar. It's my pleasure and distinct honor to join this group. I am not the master in that field on the brainstem, but I like to be part. And I can run the moderation on this aspect. I'm seeing expertise in that field, and I'm glad to see them all. So without further ado, I think I will proceed to introduce the speakers. First, we have Professor Matthias Baldoccini. Is known to me and to our committee, the Neuroanatomy Committee. He is an essential faculty on this committee. He is a professor from the University of Buenos Aires in Argentina, and he runs the directorship of a neuroanatomy lab with major contribution in skull base and vascular, witnessed by a lot of publication and presentation. He's going to start talking about the neurosurgical anatomy of brainstem. Go ahead, Matthias.
Thank you. Thank you very much, Imad, for your kind presentation. Thanks, Samet Morsi, for your kind invitation. I'm really happy to be here with so many friends from who I learned during my my residency training and nowadays to Professor Atul Goel, Sanjiva, Professor Vladimir, all friends from this passion that is the neurosurgery. And happy to see you, Kant, too. I learned so much from your publications about brainstem anatomy, and it's a huge honor to me to be sharing this this webinar with everyone. Okay. I will share my presentation. Can you observe properly my slide?
Yes, perfect.
Excellent. In the next minutes, I will introduce the general aspect about the brainstem and neurosurgical anatomy, focused in the general superficial anatomy of the three components of the brainstem, focusing in the neurovascular structures that are related with the midbrain, bones, and medulla oblongata, and trying to describe the systems that are in close relation with the surface of the brainstem in order to be as an introductory lecture about brainstem neurosurgical anatomy. Okay, this is a midline sagittal section of the brainstem. It is important to remember that the brainstem the brainstem have an anterior surface, a posterior surface, and lateral surfaces that are related with different structures. And the three components of the brainstem, starting from above to the inferior segments, there are the midbrain or mesencephalon is the part that is in close relation with the encephalon or the thalamus, the most medial portion of the brain central core. The pons is the middle part of the the brainstem, and the caudal portion of the brainstem is we will find the medulla oblongata, or simply the medulla. In the sagittal section, we will find that the brainstem is located almost completely in the posterior fossa, but the superior part of the midbrain could be located in the supratentorial space due to its close relation with the free edge of the tentorium. This section is very important because we will describe the close relationship with the different cisternal spaces with these three segments of the brainstem. Here we will find the interpeduncular fossa, the prepontine cistern, interpeduncular cistern, the premedullary cistern. Here we will find the cisterna magna, and here it's located the quadrigeminal cistern. This is very important because we can observe this relation with the cerebrospinal space, with the subarachnoid space, sorry, in the different MRI scans. Here is located the interpeduncular cistern, the prepontine cistern, the premedullary cistern, the cisterna magna, and here we will find the quadrigeminal cistern in close relation with the surface of the brainstem in the three portions of this structure. In this beautiful anterior view of the brainstem, we will find that the superior limit of the brainstem, it's well demarcated because we will find here the optic tract. The inferior border of the optic tract is the superior limit of the brainstem. In the caudal portion, there is, in the midline of the medulla oblongata, we will find some fibers. Sometimes it's easy to observe it, and in some specimens are not so easy. We will find some fiber that cross to the contralateral side towards the midline. That is the corticopyramidal tract decussation, and the inferior border of this decussation will show us the inferior border of the medulla oblongata. Another anatomical structure that we can use for demarcate the inferior border of the medulla oblongata is the superior border of the first dentate ligament. There is a superficial demarcation in the anterolateral surface of the brainstem. Here we will find the pontomesencephalic sulcus that separates the midbrain to the pons, and here we will find the pontomedullary sulcus. And in this anterolateral view, we will find the rootlets of the different cranial nerves from the third cranial nerve, the fifth cranial nerve, the 6, 7, 8, 9, 10, 11, and the 12th cranial nerve. There is a cranial nerve that emerges from the brainstem, from the posterior surface, that is the fourth cranial nerve, or the trochlear nerve. In this anterior surface, we will find the interpeduncular fossa, and in the lateral border of the interpeduncular fossa, we will find the middle mesencephalic, the anterior middle mesencephalic sulcus, that is the beginning or the apparent beginning of the third cranial nerve. And there is a region very important that it's fenestrated with a lot of small holes where the thalamoperforating arteries introduced to this substance to irrigates especially the thalamus and some hypothalamic structures. The midbrain will have an anterior surface. This is the interpeduncular fossa, and there is an important division in the midbrain due to the substantia nigra. The substantia nigra divide as the tegmentum to the peduncular to the pedunculum in front of this segment. This is very, very important. We will find here in this anterior surface these small arteries which start from the basilar artery and from P1 segment. This is the thalamo-perforating arteries. And this is the third cranial nerve that are crossing from the midbrain to the oculomotor triangle in the superior surface of the cavernous sinus. Here is located the interpeduncular cistern. Here we will find the crural cistern, the ambient cistern, and in this posterior surface related with the quadrigeminal plate in the posterior surface of the midbrain, we will find the quadrigeminal cistern. Very important because some kind of pathology could be located in this region, especially the tumors which grow from the pineal gland, and it's a complex region to achieve microsurgically. And here in this sagittal section of this T1, we will observe the interpeduncular cistern, the crural cistern, the ambient cistern, and here the quadrigeminal cistern. In this beautiful cadaverical specimen with Mulligan technique, we can observe this small hole that is the Sylvian aqueduct, and it is surrounded with some gray nucleus, and this is the substantia nigra that that for sure Canan will talk about the fiber tracts in the next presentation. But it's very important to keep in mind that the position of the substantia nigra divide us the midbrain or the mesencephalum in two important segments, an anterolateral segment and a posterolateral segment with several divisions of these fibers that cross towards the cerebral cortex, and it is very, very important. This is a section with Mulligan technique. At the level of the optic tract, we can observe here the optic tract surrounding the cerebral peduncle in this left section, and this is a beautiful dissection, beautiful coloration of Mulligan, where we can observe the lateral geniculate ganglion and the fibers that arrives to this second neuron from that is located in the lateral geniculate ganglion. Here is located, as I said previously, related with the anterior surface of the midbrain, the interpeduncular fossa, and here we will have the quadrigeminal plate. The quadrigeminal plate covers the posterior surface of the Sylvian aqueduct or the mesencephalic aqueduct, and in the posterior, if we observe this surface from a posterior view, we will find the two superior colliculi and the two inferior colliculi in the right and in the left. That is, these structures are part of the auditory system and the visual system due to its connection with the medial and lateral geniculate body of the thalamus. And here we will observe the superior limit again of the midbrain, well demarcated with the optic tract arriving to the lateral geniculate body in this section. This is the middle geniculate body, and the lateral geniculate body is here. And the perimesencephalic cisterns are, composed by the group of the interpeduncular, crural, and the quadrigeminal ambient and quadrigeminal cistern in the posterior surface. In this view, with more zoom, we can observe again this interpeduncular fossa and the posterior perforated or fenestrated substance where it's full of small branches from the posterior circulation. This is very, very important. And this is the anterior view of the cerebral peduncle that is really, really important, because we will find here fibers from the frontopontine circuit that arrive to the pontine nucleus in order to form the fibers for the neocerebellum. In the center of this segment, we will find the corticospinal tract, and laterally the fibers to the neocerebellum again, but from the different lobes, from the temporal, parietal, and occipital lobe, of course. This is a beautiful dissection from a friend, Richard Parraga, a friend and colleague. This is a beautiful, beautiful dissection from a lateral view of the midbrain, where we can observe the substantia nigra here, and here we will find the red nucleus. This red nucleus is really a small nucleus, but it's full of connections that show us the impression of a huge nucleus, but it's a small nucleus. In order to access to the posterolateral and lateral surface of the brainstem, we can use the superior, the supracerebellar infratentorial corridor in order to access to this surface, to the ambient cistern that is located in this segment. In this sector, we will find growing from inferiorly to the inferior colliculi, the fourth cranial nerve. The fourth cranial nerve turns around the midbrain previous to enter to the free border of the dura mater in this point. This is a very small nerve, and we should take care when we access to this surface. And here in this sector, there is an important structure that is the lateral mesencephalic sulcus. The lateral mesencephalic sulcus is the lateral projection of the substantia nigra. In other words, in front of the lateral mesencephalic sulcus, we will find the cerebral peduncle, and posteriorly we will find the quadrigeminal plate or the tegmentum. This is an important landmark for the safe entry zone to the brainstem, especially to the midbrain. And there is two windows: the supratrochlear and infratrochlear window to access to this region. This is a pure posterior view of the midbrain with the quadrigeminal plate with the brachium conjunctivale that connect the superior and inferior colliculi with the lateral and middle genicular body. Talking about the pons is the middle part of the brainstem, and the unique cranial nerve that grows, that emerges from purely from the pons is the fifth cranial nerve, the trigeminal nerve, and grows from the superior third of the pons. Here, this is a beautiful view. The pons, it's the posterior surface of the pons. It's a part of the floor of the fourth ventricle, and the anterior surface is related with the prepontine cistern, and the lateral surface form part of the medial wall of the pontocerebellar cistern. Very important structure, because many pathologies should be achieved entering to the cerebellopontine cistern for operating tumor or neurovascular lesion, especially. In this beautiful sagittal MRI, we can observe the cerebrospinal fluid filling the prepontine cistern and the pontocerebellar cistern. In this anterior view, we can observe that the pons, the name of pons is because we have here like small bridging fibers that connect both cerebellar hemispheres. If we start to dissect this fiber, we will find like a corpus callosum of the cerebellum forming part of this commissural. There is not properly to use the name commissural, but it look like this. Fibers that cross from their left and right hemisphere. And behind to this fiber, we will find the fibers that form part of the cerebral pontine fibers, and fibers that are part of the corticospinal tract that once it passes the pons are compacted again in this segment that are the pyramids of the medulla oblongata in order to cross mostly of this fiber to the midline. Here, another beautiful dissection from Richard. We can observe these fibers well dissected. Of course, Can will explain it perfectly in the next presentation, but it is interesting to observe that there is this crossing fiber. There is three layers of the main fiber that cross from one hemisphere to the other: the superficial, medial, and deep fibers that cross, and the name of this deep fiber are trapezoid body. Here it's located the fifth cranial nerve. Here we can observe the fifth cranial nerve, and the entry point of the fifth cranial nerve, it's an anatomical landmark, very, very important, because we can divide from this point medially, anatomically it's located the pons, and laterally the middle cerebellar peduncle. In this beautiful old roton dissection, and this is an anterior view of the brainstem, and mostly the pons has been removed in order to observe that in the posterior surface of the pons we will find the fourth ventricle. It's very, very important because the posterior surface of the pons forms entirely part of the anterior wall or the floor of the rhomboid fossa of the fourth ventricle. Here it's the region where the fifth cranial nerve entry to the pons, to the brainstem. And in this point, it's very, very important to separate the middle cerebellar peduncle, that are fibers that comes from the dentate nucleus. It's one of the main fibers of exit of the dentorubral or dentothalamic pathway. In this beautiful cross section with Mulligan technique, again, we can observe this with this blue coloration, the pontine nucleus. This pontine nucleus receives the fibers from the frontal lobe, temporal, parietal, and occipital lobe from different kind of information in order to give this information to the contralateral cerebellar hemisphere in order to start the neocerebellum function that it's one of the main function is to coordinate the fine movements and delicate movement that we do daily, as for example neurosurgery. And here is located the middle cerebellar peduncle. Another beautiful section. Here we can observe the fifth cranial nerve, the floor of the fourth ventricle, that it's here represented by the posterior surface of the pons, of course. And here we'll observe the superficial fibers, the medial fibers, and the posterior fibers. And of course, on the floor of the fourth ventricle, we will find it in the blue color because it's mainly represented by nucleus that form part of the floor fourth ventricle. About the medulla is the lower part of the
Brain
brainstem.
diffusion restriction, right ACMC territories.
Sorry, the medulla oblongata, or simply the medulla, is the lower part of the brainstem. In front of the medulla, we will find the premedullary system, the cerebellomedullary system laterally, the cerebellomedullary system where it could be crossing the pica artery, and in the posterior surface of the medulla, the superior part will be part of the rhomboid fossa or the floor of the fourth ventricle, and in this portion we will find the cisterna magna. That is the biggest cisterna of our brain, and of course anterior to the medulla, it's crossing the vertebral arteries and the spinal, the anterior spinal arteries that are crossing in close contact with the anterior surface of the medulla oblongata. Of course, if we observe this anatomical detail, it's easy to recognize in MRI, the premedullary system and the cerebellomedullary system posteriorly. Here we are inside of the fourth ventricle, but if we use an inferior section of this MRI, we will find the cisterna magna. Very interesting. And in this point, we will find the obex. Yes, the obex is the lower part of the fourth ventricle, and in this place will be located the foramen of Magendie, that is an exit point of the cerebrospinal fluid from the fourth ventricle to the cisterna magna. In this anterior view, we will find an anterior medial sulcus, the pyramids that is represented by the fibers that form the cortical spinal tract in the medulla oblongata, and laterally we will find these structures that are the olives. The olives are random structures, and there are longest in the cephalocaudal direction, and there are important sulcus related with the olives, the Preolivary Sulcus and Retroolivary Sulcus, where the fibers of the hypoglossal nerve, the rootless, are located in the Preolivary Sulcus. In the Retroolivary Sulcus, especially in the superior, in the fossa, supraolivary fossa, we will find the 9th cranial nerve, the 10th cranial nerve, and the 11th cranial nerve in this place located. It's very important to remember that we will find in the medial segment the anterior median fissure. I don't know why. Yeah. Okay. Sorry. It's important to remember that we have here the anterior median fissure, the preolivary sulcus and retroolivary sulcus. And here we will find the pontomedullary sulcus. The point laterally to the inferior foramen caecum, we will find the fibers of the 6th cranial nerve, and more laterally, superiorly to the supraolivary fossa, we will find the 7th and 8th cranial nerve growing in this sector. Laterally to the superior olivary fossa, we could observe some different structure. This is plexus choroideus that is going out of the fourth ventricle through the foramen of Luschka that is located from the right and the left side. This is very important. If we introduce a dissector through the foramen of Luschka, we will be inside of the lateral recess of the fourth ventricle. Here we can observe the fibers in a compact shape here in in the midbrain, at the level of the pons, the fibers are not so compact because the fibers find the crossing fibers of the pons, and here we can dissect again the fibers in a compact shape before to cross in the midline in order to the cerebrospinal cord decussation in the inferior border of the medulla oblongata. Another beautiful dissection. Here we can observe the cortical spinal tract crossing the different segment of the brainstem. Of course, Jagmurro will speak in close detail about this beautiful fiber. Remember that the olives are the dimension then of the olives are 13 millimeters in the anterior cephalocaudal direction, and lateral direction 7-8 millimeters and no more. In this Mulligan dissection, we will find in the deepest portion of the olive, we will find this nucleus that is similar to the dentate nucleus of the cerebellum, that the name is superior olivary nucleus, that is here located, and we can observe it perfectly. And here the surface that is related with the inferior portion of the foreventricle. This is the rhomboid fossa. That is not a topic for today, but remember that the posterior surface of the pons and the superior portion of the medulla oblongata are part of the floor of the foreventricle or the rhomboid fossa in this segment, with several important structures, different nucleus that are located in this sector and are really, really important, but it's another topic that it is